Welcome back. In this section, we will learn about what makes individuals or workers susceptible and/or vulnerable to workplace hazards. Specifically, we will define what we mean by these terms and provide a few examples on factors that influence susceptibility and vulnerability. So when we're talking about worker populations, it's important to distinguish between susceptibility and vulnerability. While these terms are often used interchangeably, there are slight distinctions worth noting. So according to the U.S. Environmental Protection Agency, or US EPA, susceptibility is defined as differences in risk resulting from variation in both toxicity response or sensitivity and exposure as a result of gender, life stage, and behavior, which can explain why some people have worse impacts from environmental hazards than others. Susceptibility is also referred to as the induction of health effects after exposure or factors inherent to physical predisposition, such as genetics. You can think of susceptibility as a capacity, a trait, or a factor that leads to a higher risk at a given exposure level due to biological or intrinsic factors that can modify the effect of a specific exposure. While vulnerability often refers to external factors, vulnerability additionally considers the probability of exposure and capacity of response, for example, coping and adaptability, or the ability or preparedness to withstand the effects of hazards and the ability to recover from these effects resulting from environmental health hazards. The U.S. Environmental Protection Agency defines vulnerability as differences in risk resulting from the combination of both intrinsic differences in susceptibility and extrinsic social stressors, such as low socioeconomic status, crime and violence, lack of community resources, access to healthcare, education, poverty, segregation, geography, and other factors. You can think of it as the capacity to be at an increased risk of being harmed as a result of both intrinsic or biological factors and extrinsic factors, which could be environmental, including the natural environment, the built environment, and social and behavioral factors. When we talk about susceptibilities, we need to keep in mind that these can be intrinsic or innate, or extrinsic or acquired. Innate factors are biological factors that cannot be changed. For instance, an individual's life stage might affect his or her susceptibility to chemicals or pollutants. For example, exposures to many chemicals during the preconception or prenatal period, which are important life stages, may have long-lasting adverse health impacts on children. So a pregnant worker exposed to chemicals at the workplace, for example, may have an increased risk of adverse reproductive outcomes or adverse health effects in their children depending on the chemicals they're exposed to during these critical windows. We also have to keep in mind that different population groups might also experience varying susceptibilities, and there are intrinsic and extrinsic factors that affect an individual's or population's susceptibility to pollutants. Extrinsic or acquired factors are exposure-related factors that can be changed in most cases. So let's go over a few examples of factors that may make an individual or worker susceptible to exposures. So intrinsic or biological susceptibility factors include age, life stage, gender, and genetics and toxicokinetics. Previously, we discussed how life stage can impact susceptibility, such as when exposures during the preconception or prenatal period could impact children's health. Similarly, age is an intrinsic factor that can impact susceptibility. For example, if a child worker is exposed to chemicals at the workplace, they may be more susceptible to the adverse health risks associated with those chemicals, given they are still developing. Gender is another intrinsic factor impacting susceptibility. Women, for example, may have a different susceptibility to the impacts of toxic chemical exposures that may be due to differences in physiology and in connection with their reproductive cycles. With generally a higher proportion of adipose tissue, women are also more likely to store more environmental pollutants in their tissues. Another intrinsic factor includes genetics. For example, genetic polymorphisms, which refers to an alteration of a certain DNA sequence, can contribute to phenotypic differences amongst individuals, including disease risk and drug response, which can play a role in the metabolism and detoxification of chemicals. Toxicokinetic differences among individuals that affect how easily a chemical is absorbed, metabolized, and excreted are also important intrinsic factors that can impact an individual's susceptibility. Again, these are all biological factors that cannot be changed. Now, extrinsic factors affecting exposure susceptibility include things such as disease status, socioeconomic status, nutrition status, and various lifestyle choices. While some of these extrinsic factors may be modifiable, in reality, it is not always easy to do and may be shaped by structural and systemic barriers. So now we will go over a few of these extrinsic factors to see how they impact an individual's susceptibility. So when it comes to disease status, individuals with pre-existing diseases could be more susceptible to the potential adverse health risks that could result from exposure to pollutants, or in the case of workers, those with pre-existing diseases may be more susceptible to the adverse effects associated with workplace exposures. For example, an individual with pre-existing asthma might be more susceptible to the potential effects of air pollutants and other respiratory irritants compared to a healthy individual without a chronic respiratory condition, as pre-existing medical conditions can directly influence the underlying processes that are involved in the response of an individual to a contaminant by compromising their immune response. Another extrinsic factor includes socioeconomic factors. Some communities, for example, those who may be low income and marginalized communities of color, often bear a greater exposure burden, as well as disease burdens associated with where they live, work, or play that can increase the risk of adverse health effects from environmental hazards. Research into how socioeconomic factors and stress exert influence on health has identified clear biological pathways. Stress linked to or arising from socioeconomic factors is associated with differential baseline levels and the differential response of the hypothalamic pituitary adrenal system. That is, social factors may describe people with different biological states that will influence susceptibility to exposures in general. Now, susceptibility can also vary based on lifestyle factors, including exercise and substance use like smoking or alcohol consumption, that can be modified to build the immune system and reduce susceptibility. Someone's lifestyle may impact their response to external stressors, including pollutants inside and outside the workplace. For example, smoking can impact an individual's respiratory system and, in turn, how the body may respond to respiratory irritants. Smoking has been shown to reduce the body's antioxidant capacity, and reactive oxygen species from outdoor air pollution can lead to immunological changes that can contribute to chronic obstructive pulmonary disease development. Diet and nutrition status can also play a role on an individual's susceptibility. Susceptibility can vary based on diet that can be modified to build the immune system and reduce susceptibility to environmental exposures. It's important to note that diet may be related to culture and cultural norms within a given subgroup, and this may not be easy to change. So differential responses can result from differences in genetic susceptibility or because of exacerbations or ameliorations of the effect of exposure by underlying disease status, psychosocial factors, or sociodemographic factors like poverty. Differential response can also flow from more complex social or physical factors or more than one interaction. For example, it has been shown that persons with diabetes have twice the risk of cardiovascular mortality after exposure to particulate air pollution compared with persons without the disease. Now, we can break down vulnerability according to intrinsic and extrinsic factors. Intrinsic factors are mostly unchangeable factors such as age, life stage, sex, race and ethnicity, genetic polymorphisms, and toxicokinetic differences. And you may recognize these as the very definition of susceptibility that we went over. However, there are also extrinsic factors, which include factors like low socioeconomic status, as well as crime and violence, which have a greater impact on low-income communities and communities of color. Another factor that plays a role in vulnerability includes geographic proximity. Certain populations or groups can be highly exposed to contaminants because of geographic proximity to contaminant sources. Population groups at risk of high exposure due to geographic proximity include people living near or working at a facility that is the source of a contaminant. Specific examples include people living downwind from a coal-burning power plant, those near and using a polluted water body, or those living or working near roadways with high levels of vehicular traffic. Individuals living in housing near major roadways or in buildings in disrepair might also have higher exposure to certain types of contaminants than individuals in other settings. Another extrinsic factor is lack of resources. Low-income and communities of color often lack adequate resources, which can impair the capability to prepare for and recover from environmental stressors. Lastly, another extrinsic factor that can impact vulnerability is healthcare access. Lack of access to proper healthcare is prevalent among low-income and communities of color. Now, it's important to note that oftentimes these factors are not mutually independent in many communities. That is, we often see several of these factors in some communities as a result of systemic and structural barriers and racism. So, who is a vulnerable worker? Well, unfortunately, not everyone gets to go to work healthy, free of stress, or into friendly and supportive workplace environments with the essential workplace protections, and this vulnerability may also occur as a result of many factors. While the goal is for workers to go home healthy and continue being productive members of society in every aspect of life, the reality is that several factors, many of which are beyond the control of workers, can impact their health and safety, making them more vulnerable to workplace exposures. So what are some of these factors that can play a role on a worker's vulnerability and threaten their well-being and safety at the workplace? Well, a worker might have a physical condition, either acute or chronic, that may impact their performance at work or make them more vulnerable to workplace exposures. As we discussed previously, for example, a worker with asthma might be more sensitive to chemical exposures at the workplace. In addition, someone's sex may pose a higher risk. For example, a woman who is trying to conceive or is pregnant may encounter workplace exposures that may negatively impact reproductive and children's health. In addition, there might be psychological problems and other types of developmental or mental health disorders that may make workers more vulnerable to potential workplace hazards. Someone's social environment may also contribute to discrimination at the workplace. The social environment may lead to discrimination. Either the coworkers or a boss may think a worker is too old, too young, or disabled and not able to do a job. Personal characteristics may also play a role. Examples are race and ethnicity and immigrant status, which may make a worker subject to discrimination. In addition, socioeconomic status may play a role, as those taking the riskier and more hazardous jobs tend to be populations of color who are also underpaid and who have less choices about taking on safer jobs. There might also be economic or political context that's an issue or a challenge for a worker. Some have fallen on hard times, some are unemployed, or they have a history of incarceration. We will go over some of these examples in the following slides and also dive deeper into some of the issues during this course. So one example where sociopolitical factors played a role on worker safety and health, leading to a major tragedy, was the case of the 2013 Dhaka or Rana Plaza garment factory collapse. On the 24th of April of 2013, the collapse of the Rana Plaza building in Dhaka in Bangladesh, which housed 5 garment factories, killed at least 1,100 people and injured more than 2,500. Fearing customer boycotts, Western brands worked with unions, factory owners, non-governmental organizations, and the Bangladeshi government to improve safety. This is a prime example of poor working conditions and negative consequences that result in some countries, and in the US, where the poorest workers hold the most menial jobs with the most dangerous hazards. And still, they are not seen as worthy of health protection. It is also widely recognized that disparities in economic opportunities expose minorities to greater risk of workplace injury and disability. Another case where several factors played a role in rendering an occupational population vulnerable is the case of migrant farm workers. In the U.S., the majority of the farm worker labor force consists of immigrants from Central and South America. These include low-wage workers that are often not provided any safety training or proper personal protective equipment, or PPE, to do their jobs. They often do not speak English and lack access to proper health care. Between 2004 and 2005, farm worker women who were working in agricultural fields in North Carolina and Florida for the same company had babies born with severe birth defects. One was born without any arms and legs. Another infant was born with Pierre-Robin syndrome, which is a rare birth defect that is characterized by an underdeveloped jaw, backward displacement of the tongue, and upper airway obstruction. And another infant was born with multiple malformations, including cleft palate, lack of visible sex organs, and a solitary kidney, and unfortunately died 3 days after birth. 2 of the women involved in this case study also reported prior stillbirths, and all of these births took place within 3 months of one another. It is suspected that heavy exposure to pesticides at the workplace led to these birth defects. The company had a history of using toxic pesticides and many workplace violations. These included spraying fields with workers present, ignoring re-entry time intervals, which is a time period that workers should wait before entering fields after it has been treated with pesticides. It was actually reported that the company ordered workers to re-enter recently sprayed fields before the recommended airing out period had passed. The company also failed to provide personal protective equipment to workers. They were also known for burning used pesticide containers next to the fields and workers, and for applying pesticides up to 3 times as often as allowed by law. It was actually an outreach worker that put 2 and 2 together and discovered the series of abnormalities. The company had a history of citations for workplace safety violations, and the case resulted in a monetary settlement. A few years later, the company also sued for cheating thousands of Latin American migrant workers out of their full wages. So, as noted by the U.S. Environmental Protection Agency, noting the distinction between susceptibility and vulnerability is important because considering each of these in public health and occupational health assessments, for example, in risk assessments and workplace hazard assessments, is key to protect populations at greatest risk when implementing interventions and making risk management decisions. When considering public health implications of research focused on exposures, whether they're chemical or non-chemical exposures, the resulting interventions, policies, and recommendations typically deal with vulnerability as they consider susceptibility in conjunction with the likelihood of exposure and response capacity of the target population. Lastly, failure to identify subgroups based on differential vulnerability can lead to masking of pockets of inequity. So I hope this helped understand the unique subtleties between susceptibility and vulnerability and how these play a role in worker health and safety. Thank you.